has been around for actually quite a while. We've been doing this for over 5 years, and actually started development 7 years ago. And we're in the process of continually adding additional features and capabilities to it. In particular, the fact that the system currently handles 300,000 patient calls a month in 34 states. And we're constantly getting feedback on different ways to improve the system from everybody that's on the system. So we'll probably come out with new features every other week or so based on live feedback we're constantly getting. Now, the system is currently integrated with Allscripts Professional and Allscripts Touchworks. We've been working on Sunrise support, so if you have any questions about that, you can either send us an email or send us a question on the chat session. You could enter anything you want into the chat session at any time, and we'll try to respond. The way our system works is that basically, CallMyDoc, we set up a phone number or multiple phone numbers. Every single phone number can be customized to do exactly what you want. So in other words, it's like you're hiring 1 or 10 or 20 additional staff to help manage the phones. Now, when I say help manage the phones, 2 parts to it. One of which is it helps manages the phones during the day. And by that, I mean there are 2 aspects to it. One of which is that you never want to use voicemail ever again. You want to send every call to a CallMyDoc number that a live person cannot pick up, period, because everything is automatically picked up by CallMyDoc using the different phone numbers that you get set up. They're automatically transcribed from the patient directly into various tasks that go directly into Allscripts Touchworks and Allscripts Professional. And we'll have a look at that in just a minute. Not only that, but it tracks how quickly people are following up. It tracks everything about every single phone call, period. And it displays it. It's kind of like having a visual voicemail for all patient calls, period. So I'll show you that. We also have an app. Now, people use the app during the day as well. I'm going to talk about it in the context of how it's used after hours, because this system basically replaces any after hours answering services. It tracks every single call, shows not only the patient call on the app, but the chart as well. And then the app can be used to call the patient back on its own, or it can be used to click one button to call the patient back. And every single phone encounter is automatically downloaded and put back on the patient's chart. I'm not really into talking too much, so I'd way rather just show you guys because this is the fun part. So here's what I'm going to do. As I mentioned before, I'm going to call into this phone number. Now, every phone number, again, can be customized to do whatever you want. In this example, this is currently set up to act like an after-hours answering service. It could be set up to act like a call center. It could be set up to act like really anything you want. As we go through it, I'll point out the different aspects to it and what's happening in real time. Now, I'm starting with the after-hours example because the after-hours example and the daytime are kind of intertwined because it's not just one thing. In other words, we're in so many practices and so many locations across the entire country that the system literally can be set up to do just about anything you could ever think you'd want it to do to help handle your phone calls, either after hours or during the day. So when you're looking at this system, if it doesn't sound exactly the way you want, or you think you'd like it to do something different, 99% of everything we're about to go over and discuss can be customized to do exactly what you want, except for the part where it's going to ask the patient for their date of birth which you'll see that and hear that in just a minute. So I'm going to dial into that number, and I'll point out different things that are happening as we're going along.
Press 1 for English. Presione 2 para español. Appuyez sur 3 pour le français. Please select one of the following. Press 1 for medical tech. Welcome to Allscripts Touchworks version 19 test office. The office is currently closed. If this is a medical emergency, please call 911 or go to the nearest emergency room. If you are an established patient or calling on behalf of an established patient, please press 2 immediately to be helped as quickly as possible. Otherwise, please enter the patient's date of birth by using your keypad to enter 2 digits for the month, 2 digits for the day, and 4 digits for the year. You have entered September 18th, 1963. If this is the code, please wait while we look up the medical chart for the patient. If you have an emergency and need to speak with the provider on call, press 1. If you have a question about your bill or labs, or some other non-urgent issue you would like to share with our office, press 2.
I'm going to press 1 to reach the doctor on call, and then I'll discuss what's happening here.
Would you like us to return your call to 424-263-2017? If yes, press 1. Please speak the patient's full name slowly and clearly. When done, press any key. Then you will be asked for more information.
Carl Silva.
Now, please leave a detailed message as to why you are calling, any symptoms you are experiencing, and any other information that would help us expedite this call. Please speak slowly and clearly. When done, press any key.
Okay, so as I mentioned, everything up to this point can be customized, except for we have to ask the patient for the date of birth, and I'll explain that more in just a second. Right now, as I'm talking, this is going to transcribe everything I'm saying directly into a task that can be pushed to anyone in Touchworks or Allscripts Pro. And it's also going to push this transcription with my chart to the app, and look at both of those in just a second.
Once the provider or office has listened to your message, we will contact you at 424-263-2017. Thank you for calling. Goodbye.
So it's already in the system. Whoop, there it is. So it's here, okay? It's in my app. It's also going to be in a task, assuming this refreshes. Whoop. Hang on a second. But we'll look at that in just a second. So in any event, like I said, you get one or multiple phone numbers. This one is currently set up to act like an out-of-hours answering service. When I call in, I have to enter my date of birth, because think of this system like a virtual front desk attendant or anyone else, really. I mean, if I called your practice right now during the day and I said I have a billing question, I need a refill, whatever, they're going to have to ask for my date of birth, right? We just do the same thing. So I can guarantee you, if you could turn this on today with your patients or tonight, your patients would just start using it. There's no patient training. And again, this system's been in place for over 5 years and currently handles 300,000 patient calls a month. We just passed 6.5 million patient calls in total, and it just works. Once we've identified who the patient is, in this example or demo, this is, excuse me, I'm sorry, I was looking at something. In this example, there's 2 things they can do. Now, this could be programmed to do something different, but it just shows 2 different examples of what we were discussing earlier. So it says press 1 to reach the doctor on call, and that's handled through the app. And then press 2 is have some other question. Okay, so what happens when I press 2 is, as I mentioned before, we have full mapping, the ability to map anything, any calls into any inbox, period. Not only that, but we support every single voice that's currently supported by Google Voice and Amazon Alexa. So there's an extreme level of customization here. We also support 15 different languages. And what would happen if I called in Spanish, this is going to automatically transcribe my Spanish. Well, maybe it would transcribe my bad Spanish, but anyway, it'll transcribe my Spanish into English text as well to push into a patient case, into a task. Now, as I mentioned before, we could transcribe different call types into different buckets. So these are all the ones where it's a date of birth, because when patients call in your office, they're not calling for a cheeseburger. I mean, they're really calling for the same stuff over and over again. I need a refill, I need a referral, I need an appointment, blah, 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 etc. So what we do is we just map their questions into one of those 12 different categories, period. And then you could decide who's supposed to get these. So in my example here, I just have these all going to my inbox because I felt like it, but I could have said these could go to, billing person, these could go to somebody who's dealing with lab results, et cetera, et cetera, et cetera. So let's look at the app for a second. Okay, now when it comes to the app, what types of calls I get on my app, when I get those calls, how I get notified about those calls, and every aspect of that is completely customizable. So I just have mine set to say out loud, you have a patient call. I also have it set to text me. It could be set to call me to remind me. So when I click on this, it's opening up the app. And this is just a little extra layer of security in case I forgot to lock my phone, because that photo and name is coming out of my chart in real time. So when I click on it, it's spinning for a second because it's pulling a bunch of information off the chart. And everything here is coming in real time out of the chart. So I see a couple of questions here. I'll get to that questions here in just a second. So the first thing you get is you get the patient's information, you get the patient's demographics, and you get the patient message transcribed. And if I wanted to, I could play it. Oh, sure. Okay, so as I mentioned, everything up. But these are typically what our transcriptions look like. Our transcriptions are 95% or so accurate. However, some people will call you while they're riding a bicycle and eating a sandwich, so you may have to actually listen to the message, but that's the exception, not the rule. The other point of this is that we don't just throw a live call into your lap at 3 o'clock on a Sunday afternoon. You get to screen your call. So I already know who's calling, and I know what they're calling about. Yes, every aspect of this, the on-call component of this can be completely customized. In addition to that, we don't yet integrate with Allscripts PM. However, we do pull up PM information out of Allscripts Professional, which I could demo to you a bit later. We also have BAAs in place with Amazon and with Google. And yes, it did take a while to get those in place. But like I said, we've been doing this for quite a while now, so we've got all those different pieces covered. So, okay, who's this patient? Why do they want to talk to me? Then I swipe the screen from right to left, and now I got a summary of the patient's 3 most recent visits. And this is labs and other documents. So literally all the documents that are on the chart should be here. This just happens to be a little test chart. No active medications, etc. So who's this patient? Why do they want to talk to me? What's happening with this patient lately? And then you swipe again, you hit take session for several reasons. First of all, when you hit take session, it starts the meter running. So when I hit close session, it's going to measure how long this whole entire phone call took, phone encounter rather. In addition to that, when I hit close session, it's going to document the call and put it back on the chart. We'll look at both of those as we get a little bit further along. So I want to call the patient back. I hit the phone icon, and I hit this green bar. And this is going to launch a conference bridge automatically out of our server between me and the patient.
Please be patient, connecting you with the patient or caller.
And so one leg of the conference call is my phone, and the other leg of the conference call is my patient phone, which would be ringing with the caller ID of your practice or office that you want displayed.
Oh, this is Allscripts Touchworks version 19 test office calling you back. The provider would like to speak with you now.
And then we're connected. And that goes just because both phones are in the same room. However, the thing is, because you know who's calling you, you already get a heads up of about what the situation is, whether you're using this after hours or during the day or both. But I'll show you other examples as well. We do not charge for staff usage of the app if they're going to work remotely. And I'll get into that, why that is in a little bit further. So if I want to have the app call the patient back on its own, I can click on Add Response. I have a bunch of different choices here. Let's say this patient called about a refill. Well, I'm going to click on Prescribe. Again, it's going to spin for a second and pull the meds off the chart. But remember, there weren't any meds on this little test chart. I'm just going to pick something here. Again, yours will be faster than this in the production environment. Just click on this. And what this is going to do is this is going to send the prescription to the pharmacy. Then it's going to update the chart. Then it's going to call the patient and tell them they can pick it up at CVS. And I don't have to talk to anybody. So I'm going to save that. I'm also going to have it call the patient back and tell them something. I send in your refill, but we haven't seen you in a really long time. So please schedule a time to do a medication review. I'm going to save this. And then down here, this is to take notes about the call. So I've seen people dictate entire paragraphs into the section about what's happening, et cetera, because this section will go back into the task. It'll go back into the documentation of the phone encounter. It does not go back to the patient. So I'll just leave something in here. I send in this patient's refill, but we haven't seen them in over 6 months. So when you get in on Monday, could you please make sure they're scheduled to do a medication review? And then that's it. And I hit close session, and that's going to call the patient back and do everything I told it to do, like this. Hello? Speaking?
Hello, this is Allscripts Touchworks version 19 test office returning your call. A patient at this phone number contacted us with a medical issue. We are calling back now with the provider's answer. If you are the patient or a HIPAA authorized individual, press 1. To place this call on hold, get the Allscripts Touchworks version 19 test office has the following information for you. You can repeat this information at any time by pressing 1. Please listen to the entire message. This message has 2 parts. Part 1. The provider has prescribed the following medicine. Advil 200 mg oral capsule. As needed, the prescription has been sent to the pharmacy. CVS 16050 in Target. Located at 3433 Sepulveda Boulevard. Please call the pharmacy to confirm it is ready at 310-370-1021. Part 2. I sent in a refill, but we haven't seen you in a really long time, so please schedule a time to do a medication review. Press 1 to repeat this information. Press 2 to confirm you have. Do you wish to start a new session with the provider for another issue? Press 1 for yes. Thank you for calling Allscripts Touchworks version 19 test office. Goodbye.
Okay, so you get a CallMyDoc number, or you can have multiple numbers. Every number can be programmed to handle things in different types of ways, exactly according to how you want it to be handled. We're going to ask the patient for the date of birth when they call in, because you have to. There's no other way to do this. Even if it was a person, they're going to need a date of birth. Once we get that, then we could route the call to do various things with it. We even have an on-call scheduling system. When whoever's on call gets the call, they're going to know who's calling, why they're calling. They're going to know everything that's happening. Plus, when they finish, it's all documented and put back on the chart, which we're going to look at in just a minute. at least theoretically. I think that's the one I want. So anyways, just to continue, this is what we call the admin panel. Now, we're not trying to replace tasking and the way people manage tasks. Oh, there we go. That's what I was looking for. So we're not trying to replace this function, okay? We're trying to augment it, and we're trying to use it to track every single patient communication over the phone that a person couldn't pick up. So however you want it to do that, we can make it do that. Now, what happened was the first time I called in, it would have pushed this transcription and my phone number, okay? Come on, I don't know why I can't select it. Anyways, you could see the transcription down here because maybe this didn't go to anybody on call, or maybe it didn't go to anybody using the app. Well, if it did that, it would just be here. Now, it happened to go to the inbox for this fake doctor, Dr. Medicine, but it could have gone to anybody. Yes, we pull information from Allscripts PM, but we don't have a direct interface yet to PM, but we will be working on that. We're just waiting to get a test sandbox set up for Allscripts PM. But again, shoot me an email if you have additional questions, and maybe we can talk about that. I can't make the screen any bigger because I'm stuck on this screen. I apologize for that. In any event, what happens is when you respond to a patient call through the app, it says, here's the responses. We did a conference call. We sent a message to the patient. We also did a refill. And at the very bottom here, you see where it says, I sent him his patient refill, but we haven't seen him and blah, blah, blah. Okay? So let's say that I schedule this patient. So I just click on done. Well, what's going to happen is within a minute or so, that's the same thing as if I clicked on archive, because we coordinate between what's happening over here and what's happening in the patient cases. Excuse me, in the task, because at the end of the day, people use this in a variety of different ways. So some people only work these calls from this dashboard, okay? Some people only work these calls from these tasks. They're coordinated, so if you close one, it's going to close the other. But the point is that there isn't a, like, I don't say there's a very specific way that this isn't, working. In other words, people use it any way that they want. Somebody could be in primary care, and then somebody else is in primary care right across the street. The way they have their CallMyDoc set up could be totally different. But in any event, when I finish with the call, I can either click on archive here. Like I said, it would automatically synchronize itself. But when I'm finished, put everything about that call back on the patient's chart. And here you go. There's a summary at the top and a detail at the bottom. And it's going to do this for every single phone call, period. So the other thing is there's no easy way to attach a voicemail back to a chart. But what we did is that we have these things all in the system as hot links so that you can click on them and it will automatically play them back in a secure fashion from our server. So now that I get to that point, let's have a look at a little bit of what just happened there. Whatever, hang on. Okay, so you get your CallMyDoc number. We program it to do whatever you want, and whether it's talking to Pro or it's talking to Touchworks, and it works with all versions of Pro and all versions of Touchworks. It's really dependent on the Unity API interface, but in any event, this side of it is going to behave the same no matter what. So whether you're on Touchworks or Pro or moving between the two, it'll just work. Again, as I mentioned, you can use the app to screen your calls, you can use the app to call the patient back, and you can use the app to document everything that's going on. And then when you're finished, it puts all the information back on the patient's chart. So oops, hang on. I know that's pretty small, but like I said, we'll email you this. Now, if we take this a bit further, let me talk about an example specifically about what's happening during the day, because this is also a very important aspect of what's happening here, period. So what I'm going to do here is I'm going to pull up one example. Actually, let me pull a different example. Here it is. And this is an example of a site in Arkansas with, I think, 67 providers. I don't remember the exact total number. So this is the existing phone system, okay? In other words, you might have your office set up that it says press 1 for this, press 1 for the physician, 2 if you're a new patient, 3 if you need the nurse, et cetera, okay? Now, every phone system on the planet can do 2 things. It doesn't matter who made it, where it came from, how old it is, et cetera. They can always do 2 things. Someone can't pick the phone up, it could send a call to a live operator. Someone can't pick the phone up, it could send a call to voicemail. Most people are using the voicemail function because they don't necessarily have a live operator to send it to. Well, we use the live operator feature all the time, because what happens is these are all phone numbers. Regular old phone numbers, you could just call them directly. So what happens is the phone system thinks it's sending these phone calls over to a person, and it's not. It's CallMyDoc picking it up with the different numbers that are set up to handle things in a variety of different ways. So the way they've got theirs set up is that if the 3 rings, or if all the extensions are busy for that particular button press, then it's going to go to the CallMyDoc column. And so in this example, this is just for doctor or hospital calls. They have a dedicated number just to detail and track new patients. The reason why this one looks like this is, remember I told you, you can customize this any way you want. So what happens is, if I want to speak to the doctor's nurse or schedule an appointment, then no one can pick up. It's 1 of 3 reasons I'm calling. Either I'm calling to schedule an appointment, I need a refill, or I have some other question for the nurse. So that's why those are split up like that. And it doesn't show it on this, but these could have been routed to different people. Because we have the chart, we know who the doctor's primary provider is. We know other information about that patient. So CallMyDoc can be set up to be smart enough to be able to send the information no matter what. We always identify the patient, because when somebody's calling in, they're required to enter their date of birth over the phone through their touch tone keypad. At this point in time, we don't have full speech recognition for a date of birth, but we are working on it. The problem is that in this country, everybody's from someplace else. So, for example, in Los Angeles, where I'm at, the way people pronounce things, or in Arkansas or different parts of the country, may be completely different. So, for the past 5 years, we use touch tone. They enter their date of birth on a touch tone. If there's more than one chart, we'll actually look up the patient's last name and ask him to enter the first 3 digits of the last name, etc. But we always find a patient no matter what, unless their chart's screwed up. But there's nothing you can do about that, because again, if a person was having the same difficulty because there's 2 charts with the same person's information on it, it is what it is. That is the 0.00001% rule. The rest of the time, basically all the time, we're always figuring out who the patient is. So to continue with this example, we also have it set up to back up these different teams, okay? In other words, if somebody calls extension 137, it goes to the orange SAMA dashboard, and it goes to this task inbox in all scripts, and this whole routing is automatically done based on who the patient's primary provider is. In other words, when somebody calls in and they get this number, they put in their date of birth, we're going to look up who the patient's primary provider is, and based on that, then we're going to map it to this particular inbox in all scripts. So that's kind of an explanation of this when you do get this. Now, this one, I'll put a finer point on this particular example, okay? So this is an example of a practice with 22 OBGYNs that's fairly close to New York City. And they're getting lots of people who want to go here instead of driving into the city. So they've been having difficulty keeping up with the phone calls. The other problem that these guys have is that they're supposed to have 4 people at the front desk or 5. Maybe they do, maybe they don't. I don't need to explain that for everybody that's on this call. You know what that's like. So the way they've got their system set up is that if somebody calls in with an emergency, we're not going to touch that phone number. We're not going to back it up. It goes to a back office someplace, okay? Somebody calls in for an appointment and they press 1. There's supposed to be a bunch of people at the front desk, but if all of the front desk extensions are busy or if no one can pick up, then what it's going to do is it's going to send it to a CallMyDoc number that's specifically programmed to say, press 1 if you're an existing patient, 2 if you're a new patient, and boom, push that into an inbox for scheduling questions and requests. The way they've got theirs set up is that everything that can wait, we transcribe 100% of those calls. So there's 2 things occurring in this picture here. One of which is anything a person can't pick up is going to be tracked and put on the dashboard and measured. The other thing that's happening here is that prioritization of what types of calls should get picked up right away by a human being if it's possible, and which calls that can wait. Now, I'm not saying these people aren't going to call these people back. As a matter of fact, this setting up a system, something like this, makes them even more efficient, which I'm going to show you why that is in just a minute. But the idea here is that use CallMyDoc to allow you to focus on the most important things, and the other stuff you can call them back when you call them back. So let's go to some examples for a second. Let me find a good one here. Okay, so this is an example of a site we have in Alabama with 187 providers. They use this after hours and they use this during the day. And this is just an example. I have lots of examples, but let's just have a look at this one because I knew there were going to be a lot of good information on this. Now, everything on here is also in tasks, okay? But like I said, this gives them a view of everything that's happening across all 12 locations that they currently have. So they have Bessemer, they have a special nursing home dashboard that's been programmed a certain way for use 24 hours a day. There's always somebody on call in that nursing home. These phone numbers have different on-call schedules associated with them. And they have special dedicated on-call numbers for the different hospitals that are in the area, like Baptist Princeton, UABMW, because they are so large, they do a lot of work with those guys on call. They also set up a COVID-19 hotline. I don't see any calls on here today, so I'm not really sure if they're still using this, but basically this was used we would call it, it would say press 1 if this is the first time you're coming in for a vaccine or needing a vaccine appointment, press 2 if this is the second time, etc. And then those get routed to different people in a variety of different ways. But the other reason I wanted to check this out, because if you go over here and you click on metrics, this is tracking every single thing that's happening, period. So you can see in this example, we're currently handling about 16,000 calls a month for these guys headquartered in Alabama. These are the actual dates of birth. Like I said, after doing this over 5 years and the fact that it's currently 2021, either patients are calling in with these dates of birth or someone's calling on their behalf and putting them in. These are the different call types that are coming in. So this is going to give you a display of information. You can't get it any other way, period, unless you have some way to categorize voicemails and a variety of other things. It's not going to happen. Now you can see here that based on this graph, some of these are taking more than 6 hours to get back to them. Now, if I clicked on this, it's actually going to show me which individual calls. I don't want to do that right now because I'm not sure how long it's going to take to crank that information out. But in general, if you added up all of these, you'll see in general they're getting back to the patients in less than 6 hours. Couple of other things here too. When it says all other sessions, these are patient calls that may have come in where it doesn't have a specific date of birth. So you've got two choices. We can either create tasks and these can go to different inboxes, or you can also click on these and have a look at them. We support both English and Spanish. So just for grins, I'm going to call this, I'll set this to daytime, and I'll call it in Spanish. We're almost finished here.
Press 1 for English. Presione 2 para... Seleccione uno de los siguientes. Presione 1 para dejar soporte. Bienvenido a la oficina de prueba de Altscript Touchworks versión 19. No podemos... Ingrese la fecha de nacimiento del paciente. Has entrado, septiembre 18, 1963. Si esta es la fecha de nacimiento correcta, presione 1. Si no es así, presione 2. Espere mientras buscamos la historia clínica del paciente. Si tiene una emergencia y necesita dejar un mensaje para su proveedor, presione 1 si tiene alguna pregunta sobre su estado de cuenta. Presione 2 si tiene una pregunta sobre los resultados de su laboratorio o alguna otra pregunta clínica que no sea urgente.
No, why not?
3 si tiene una pregunta.
Again, yours will be faster than that.
Necesitamos devolverle la llamada. ¿Le gustaría que le devolvamos la llamada a 424-263-20-17? Si es correcto, presione 1. Si diga el nombre completo del paciente de forma lenta y clara. Cuando termine, presione cualquier tecla. Luego se le pedirá más información.
Carl Silva.
Indique lo que necesita para que podamos acelerar esta llamada. Además, si llama por un resultado de laboratorio, díganos la fecha de la prueba del laboratorio y el nombre de la prueba del laboratorio. Habla despacio y con claridad. Cuando termine, presione cualquier tecla.
Espero que ese sistema va a entender lo que estoy diciendo en español. Let's see how that works.
Una vez que la oficina haya escuchado su mensaje, lo contactaremos al...
It's already in the system before the patient even hangs up. So anyways, we called it in Spanish. It's in the zone. I mean, the other thing about it is that, like I said, we can actually set this for different types of dialects, different pronunciations, et cetera, et cetera. So at the same time, should be a task. over here, unless I'm mistaken. There it is. Boom. So just to kind of continue with our discussion, we're going to track everything that's going on all the time in one of 15 different languages. You're never going to lose a call. In other words, if a patient says they called you 12 times on Tuesday, and it's not on your dashboard, it's not in a task, they didn't call 12 times on Tuesday. In addition to that, if a stat lab result comes in at 4:55 on a Friday evening or 4:58, it's not going to be in a voicemail till Monday morning. It's going to be on your dashboard. So when you look at a situation like this, okay, somebody's going to handle these urgent ones. Someone should handle these scheduling questions because you need to book as many appointments as possible or you can't make any money. And then these other ones, you take care of them as you take care of them. At least that's the way I see this dashboard. We're storing the PDF files from the different sessions back into Allscripts Pro or Allscripts Touchworks as PDF files or RTF files. When it comes to Pro, they're being pushed back as PDF files. When it comes to Touchworks, you can actually pick what document types you wanted to generate. So again, anything that has to do with the way a person would handle your calls, CallMyDoc can do the same thing. So if I look at this, okay, what type of a task do I want to create? And what type of a note or message do I want to push back to the chart when it's taken care of? So who's supposed to get this call? The priority. Who's supposed to get it in their inbox? What type of task should it generate? What type of document should it generate? And Touchworks is completely end-to-end programmable. I'm going to track information about everything that's happening all the time. So you're never going to lose anything. And not only that, but it's without a doubt, I don't have to tell you, it's going to make everybody more efficient. So this is an example, and we have lots of examples of this, but at the end of the day, if you are letting CallMyDoc transcribe patient calls that aren't as urgent as the urgent ones, you're doing yourself a huge favor because it's going to make life a lot simpler at the end of the day. So at this point, you know, let's talk about what you could do to get this set up. We don't charge anything to set anybody up. It doesn't work like that. The reason why is because we're in so many locations across the country with so many different requirements and needs that we're going to invest in setting the system up and customizing it to do exactly what you want. So in terms of customizations, programming, et cetera, whether you have one phone number or 200, doesn't make a difference. You're going to get a minimum of a 30-day free trial. If you need more time than that, obviously this is healthcare, so stuff happens. We try to keep it within 30 days. But frankly, after a couple of weeks, you're going to know if you want to keep it or not. And the reason why we do all of this in general is because we don't charge setup fees. We don't charge testing time and this and that, because 95%, 99% of whoever goes through this process is going to keep it, whether it's used for after hours or if it's used for during the day, whether it's used for both. It's just going to work. Pricing wise, it's super simple. $119 month to month for the first provider, $45 for additional provider month to month. No long-term contract, no cancellation fees. Cancel whenever you feel like. And to get this set up, whenever you want it, all we need is you need to send us an email or ping us off our website. We would need your